Inside the Now Morning Show. I am Natalee Legore, and this morning we wanted to talk about something that we know all of you have been discussing, from testicular fortitude to testicular swelling, and we just wanted to check in with the professionals to find out about the side effects of the vaccination. So it's your body and you. Let's welcome to the program Dr. Vishi, Beharry, and Professor, this is the only time I'm going to try to pronounce it, Professor Hariharan Seetharaman. I think I got that correct. We're just going to say Professor Harry for now. Good morning to you, gentlemen.
Good morning.
Good morning, and thank you for having us.
It's a pleasure having you, because I know that this discussion is one that everybody was waiting for, but somehow didn't have the balls to carry on television. So, Doc, you know, we're talking about, we're in a COVID-19 pandemic, and of course, there are a lot of people who are concerned about side effects of vaccinations. I see people, you know, encouraging people to report their side effects. I see people reporting side effects that, you know, the doctors are saying, no, these aren't side effects. So my first question is, how do we determine what the side effects of a vaccination is? Of a vaccine, is.
Thank you for that question, and Prof. Harry will also join in after I comment.
Yeah.
We have to go back to the basics of medicine and how we as doctors identify and diagnose a problem. It's the principles for us start with a good history. And so if it is you were to present to one of us as a doctor and say, I think I have a side effect of vaccine, or I'm having this particular symptom or problem, then we will take a history. What we refer to as a history is where we sit with you and we ask you a lot of questions. Lots and lots of questions in most cases. So we would ask about your past medical conditions, we would ask about the medications you're taking. In this case, and for the last few months, we have added to that list of questions, have you been vaccinated? If you have been vaccinated, then we would ask you which brand of vaccine you have had, and we would ask you what date you've had your first dose, second dose, those type of details. It is only when we put together all of this information, then we will be able to deduce if it is the symptom or side effects or conditions that you're presenting with are in fact related to the vaccine. So for instance, some of the common side effects would be things like headaches, fever, body pains. Any regular viral illness can present with those symptoms, but we are in a COVID-19 pandemic, so we may even consider COVID-19 being a cause of those symptoms because it is one of the viruses that can cause those symptoms. There are other medical conditions that can also cause you fever, body pains, and headaches. And so we have to understand the patient's medical history, their medications that they use. We may ask other questions about other symptoms that may be linked to a particular diagnosis. So generally, as doctors, when we sit with a patient and we ask questions, we start coming up with what we call differential diagnoses. So we come up with a list of about 8 to 10 possible things that it can be, or in some instances 3 to 5. But we won't say this to the patient. It's in our thought process. And so we will then ask questions accordingly to help rule out certain things that we would have established.
Professor Harry, Professor Harry, so I hear this idea of going through the patient's history, asking questions. And of course, you know, we have the usual symptoms that people may experience from taking a vaccine, any vaccine. But now we're in a pandemic and we're hearing people talking about other symptoms, and we're talking about a virus that is supposedly new. So with that being in mind, how do we now determine these other more serious symptoms that people are talking about and saying? Because, I mean, if somebody presents to you and says, okay, doc, you know what, all these years I've never had this, and I took the vaccine and now I have it. How do you determine if, yes, it is related to the vaccine, or maybe it's just something that showed up after taking the vaccine?
Okay. That's a very, very relevant question. I want to tell you one thing, that we have vaccinated 5.4 billion people in the world now. And there are the natural prevalence of diseases. You know, even without a vaccination, we were running hospitals. We were getting many patients in our ICU. I work in ICU. We get Guillain-Barré syndrome. We get blood clots, and in the emergency room, we get what we call as the orchitis. Orchitis is the testicular swelling. These are things which are commonly prevalent in the population. Now, the direct association with the vaccine, there should be, again, this because of this 5.4 billion vaccine, we have plenty data throughout the world, what we call as the AEFI data, adverse events following immunization. Okay, this is very, very rigorously maintained by WHO and most Ministry of Health, most countries, and in our region, it is the PAHO. PAHO releases periodic reports of all the American countries in the American continent, including CARICOM, Argentina, everywhere, right? So there is a very, very stringent reporting system. Now, the clots associated with the AstraZeneca and the Johnson & Johnson is well documented. We have even actually associated and given a pathogenesis mechanism. Okay, what is the reason that a patient develops clots after AstraZeneca or Johnson & Johnson or Sputnik or any of those adenovirus-based vaccines? That's a very well clearly described pathogenesis. So the disease process itself is very well described. So similarly, with the 5 billion vaccines administered, with all the reports, we know that vaccine can be related to only these type of side effects. Okay. So only when these presentations fit into those type of side effects, our antenna will go up, and then we will further investigate to see whether that particular vaccine has caused this type of a side effect. Yeah. But if it is a completely new one, which has never been reported, it is not a causative association. It is just an incidental finding. It's just that he or she had the vaccine and he developed this disease, and they are putting 1 and 2 together.
So you're suggesting, Professor Harry, that when these things happen, it's not necessarily correlated to the vaccine, but maybe just a discovery of someone's health issues at the time or after vaccination?
Exactly. I say a classic, this one of my neighbors developed a stroke before all these vaccines came up, right? And, we investigated so much, MRI, everything possible, angiogram, and, is there any other reason? The person did not have a pre-existing condition like a diabetes, or, he didn't have much of a high blood pressure, suddenly developed stroke, right? These things happen in the community. Now, I was telling that if this would have happened after vaccination, they would have put the stroke to the vaccine. Yeah. So that is how we try to, we try to find a cause, and especially when we don't like the vaccine, and when people are trying to look for something to go against the vaccine. So we tried to put 1 and 2 together, and that exactly happened with the orchiditis, or the testicular swelling, which is gaining all this notoriety, because that has never been reported anywhere in the world. Yeah. And I'll tell you that the vaccine adverse events, we do have adverse events which are, just every single event, like a rash, like a fever, headache, myalgia, everything is reported. Okay, so the numbers may look, okay, in 57 million vaccine given in Canada, there were 16,000 reports. But if you see in the 16,000, 12,000 was absolutely nothing, just some fever, headache, and the usual effects of a vaccine. So 4,000.
Dr. Beharry, let me bring you back in on the conversation, because if people are having symptoms after being vaccinated and they're more severe than the fever and headache and chills that we accept, and we keep dismissing it and saying, okay, no, we don't have this anywhere, how do we document if this is really as a result of the vaccine, if we dismiss it initially?
So first of all, when we administer the vaccine, we advise patients that it is normal to experience the usual side effects of the fever, body pains, pain at the injection site, headaches, some eye pain, some fatigue, generalized weakness. These are some of the common symptoms that you'd experience. But we know and we understand from that 5.4 billion vaccines and from previous research, we also understand that these symptoms last for up to 48 hours. And so we also advise patients, very importantly, if your symptoms persist more than 48 hours, you have to report to a doctor or a healthcare facility so that we can establish if this is something different, if it's another medical condition, or if it is, there's some other rare side effect of the vaccine causing these symptoms to persist, or any other symptoms. So you may have a sign or symptom happening and not pay attention to it, but may only feel fever or body pain. Fever, in particular, we tend to look for sources of infection. And you may have an infection somewhere else, but if the fever persists more than 48 hours, then we start thinking, okay, we have to look for another source of infection. So that is where we try to establish if it is the symptoms that persist beyond 48 hours is as a result of the vaccine or some other cause.
Right, but I'm talking about more serious side effects. And the reality is that what I'm trying to get at is, how do you determine that? Because if I come in and I say, Doc, I took the vaccine and my testicles are swollen, how do you just dismiss it and say, okay, this is not a side effect, even if you've had over 5 billion vaccines? I mean, I could be the anomaly. I could be the one that's different from everybody else. So I'm just trying to figure out, how do you determine what to describe as a symptom of the vaccine and what you determine as just dismissal has nothing to do with the vaccine?
By a process of ruling out. So let's, for instance, take the testicular swelling. If it is someone presents with testicular swelling and they say to us, well, I've had the vaccine 4 days ago, that's beyond the 48 hours. We are going to investigate. We are going to take the history, we are going to examine. We're going to start thinking of those differentials that I spoke to you about.
Yeah.
An epididymoorchitis, or infection of the epididymis and the testicle itself, testicular abscess. Those are common types of infections in that area that can cause swelling and pain. And so we will investigate for that. We will then perhaps do a blood count. We'll look for an elevated white cell count, an elevated ESR, CRP, inflammatory markers, these type of things. So we will investigate to see if it is this particular symptom or presentation can be explained by a regular medical condition that we are commonly familiar with. And if we can identify that that is the cause those are the reasons that this patient is presenting with those symptoms, then we can identify what is causing it and not say that this is particularly the vaccine. We come down to the issue of the vaccine in two instances. In one instance, if we are aware of this being a reported rare side effect, so the clotting, for instance, we acknowledge and we know and understand from the research that this is a not so common, but it's a side effect. And so if we find that there's no other pathology associated with it, no other cause for it,
right,
then we say, okay, this is because of the vaccine. If it has not been reported before, and we can't find another explanation or cause for it after investigation, then we now advance that to the relevant reporting authorities and Ministry of Health and PAHO and so on. And it is now documented as a possible new side effect. But that takes time.
Let's talk about, is it possible for somebody to experience, and I'm still going with the testicular swelling because you mentioned that this could be a side effect of COVID. Is it possible for somebody to have COVID? We aren't testing people before they're vaccinated, and therefore have that kind of symptom not because of the vaccine, but because the person probably had COVID when they were vaccinated.
It's a question for me.
Yes, Professor Harry.
Okay, thank you, Natalie.
Yeah.
The thing is, we don't test patients before vaccination, and COVID presents in many forms and many symptoms, but still the orchiditis part of it. And as I told you, as Vishi told, every single intervention has some effect or other. We try to rule out, and as you rightly pointed out, there can be one new symptom which we picked it up. But even then, if there is a direct pathogenetic mechanism, a vaccine causing orchiditis, it won't be happening in one single person in a remote Trinidad alone. It would have been because that is that is going to be reported in many other parts of the world with so many vaccines actually being
Administered.
administered. Okay, so that pathogenetic mechanism is the key and the hallmark to say that, okay, I know that this particular vaccine is adenovirus vaccine, or this Sinopharm is a inactivated vaccine. What are the effects these vaccines will cause in a human body? That is
Yeah.
what happens in the phase 1, phase 2, and the phase 3 trials. They are very thorough in all this. So if there is a mechanism which will the vaccine causing the orchiditis, it will not be in one single person in one particular island. It would have been
I agree with you. But
yes.
is it possible that we could get side effects to the vaccine because when we got vaccinated, we were already COVID positive without knowing, of course?
Absolutely, you are absolutely right. I mean, because if we had COVID and we never knew, and then we took the vaccine, and after that it just symptoms started coming in. So it can be COVID, and it may not be even the vaccine per se. And there is no way to actually completely discriminate between the effect of the COVID versus the effect of the vaccine.
Yeah. And
What we do know, if I may just add in
yes,
here,
yes, Doc, please.
we know that 80% of the persons are asymptomatic. Persons who have COVID are asymptomatic, and that still holds. And it is obviously with that sort of percentage, it is possible that I may have no symptoms, think that I do not have COVID, and go and take a vaccine. And then perhaps my symptoms may show up then or may be exaggerated at that point in time. What we do know is that if it is, I don't test you, and you are asymptomatic with COVID, and I do give you the vaccine, it is not going to cause significant harm. And that is why we are comfortable not testing you if you have no symptoms. However, in our screening questionnaire, very meticulously developed, we ask the question about flu-like symptoms. We ask if you're well today. Very first question in the screening,
Yeah.
Are you well today? Do you have any symptoms? And so if we have any sort of inkling, any sort of suggestion that you may have some or feel unwell or have anything suggestive of COVID, we will not administer the vaccine. We will defer and ask you to be tested. And so that concern of having a serious reaction or having or getting more unwell if you are vaccinated and have COVID, it's not really a big concern for us at all. And we are saying that the times that has happened around the world, it has not caused severe illness and caused significant harm to the persons.
And I think it's important for people to know that because I know a lot of people, it's one of the questions that people in the population have asked me to ask doctors over the months, because every Thursday here on TTT, we do this segment with doctors from all walks of life, all different specialities, just looking at, the name of the segment is Your Body and You. And it's one of the questions that people have asked me over the months is that, should we be tested before we get vaccinated, especially for pregnant women? And one of the things we're hearing coming forward now is women with the spotting. Is there any possibility that this is spotting? Because a lot of women are stepping forward and saying, after being vaccinated, we have this spotting issue with our periods. Is there any possibility that this is related to the vaccine and it's a symptom or side effect of the vaccine? Professor Harry?
As far as I know, there is no reported gynecological issues with the vaccines. But the vaccines cause lots and lots of immunological mechanisms. B cells are coming up, T cells are coming up, and there are lots and lots of things happening within the body. But I have gone through all the side effects, and gynecological issues has never been reported, and the spotting could have been, if this is a very new thing, and if it is again, as Vishi said, if gynecological specialists, gynecologists, investigated and rule out all other possibilities for the spotting, then we can take it up and see whether if there is any other issues related to the immune modulation in this particular person. I'll tell you one thing. We do not dismiss, and we are not here to advertise for the vaccine and say that, nothing is there, you just go and take it. We take everything seriously. All that we want to do is to filter the side effects and establish a causative mechanism, a pathogenesis, and then we accept, we agree. There is a dengue vaccine developed by Sanofi, if I can tell you that. I know that, but actually what happened when they tested in Brazil, it had some serious side effect in the sense that what we call as an antibody dependent enhancement. Okay, that means when a person got the dengue vaccine, but got infected by a different strain of the dengue virus, okay, they had a very severe form of the disease. So Sanofi and the WHO stopped it
We
totally.
are out of time already, but I have to ask, can we see that with these vaccines where we are having all of these different strains, can we see that, severe effect, or maybe some of these symptoms that people are reporting are as a result of the strains of the virus?
Okay, as far as current situation goes, the different variants have not caused any serious effects. There is no antibody-dependent enhancement. All the vaccines currently in use have done laboratory tests to actually see the T cell immunity, which is actually protective against the severe form of the disease, and that is why all of them are 100% effective against severe form of the disease, even with the current variants. So there is nothing so far which is evading the vaccine or causing any issues.
Dr. Beharry, my final question to you. Is it possible that, somebody could have these underlying problems? And I think I've asked it before, but I'm asking it again. That you have these underlying problems and they become prominent or show up after vaccination?
It's not impossible. We have seen that happen before. As Prof explained, some people think I have no medical issues and then show up with a stroke or a heart attack. In the same way, there are lots of other medical issues that could just be there lingering on, no main symptoms, or perhaps the patient is ignoring the symptoms. And then when there's that immune response because of taking the vaccine, some of those symptoms perhaps now become exaggerated, or it may even simply be that the patient is now trying to find a link to the symptoms and thinking, well, I've had the vaccine, maybe that is the cause. And that's where we try to distinguish and figure out which one is actually causing it. I may also add, you asked the question about spotting and so on, and while at this point in time the research doesn't show that there's any gynecological issues with it, we have heard of persons reporting that in conversations with the gynecologists and so on. Again, the research doesn't show that there's a direct link, but from feedback that I have gotten so far, most of these supposed reported side effects are self-limiting. And what we mean by that is that they will eventually go away. They're not life-threatening. They're not things that are going to cause a significant issue. Another one that perhaps people may be commenting on in terms of the Sinopharm is what we call a peripheral neuropathy, some sort of tingling, numbness, and so on in the arms and legs. And they tend to get scared and think it's a stroke or some nerve issue or nervous issue because of the vaccine. Again, very self-limiting. The neurologists have said they have had patients complain about it, but within 3 to 6 weeks, it goes away and you're quite fine after that. So even though it may be anecdotally reported, it's quite self-limiting at this point in time.
All right, doctors, I really want to thank you so much for speaking with us this morning, and I hope that the conversation has given the audience a better understanding of how, symptoms are, what's the word I'm looking for? How symptoms are determined. So Dr. Vishi Beharry, who is president of the Trinidad and Tobago Medical Association, thank you so much. And Professor Hariharan Seetharaman, chief editor of Caribbean Medical Journal, I thank you so much for being with us here this morning.
Thank you for having us.
You're most welcome. All right, guys, I definitely hope that was helpful for you because it was helpful for me. Definitely.
Yeah, the process is important.
Professor Harris said, listen, I had a neighbor who had a stroke. I bet if he had taken the vaccine before.
But that's the thing, is that now we live in such a time where everybody's nervous about it. Even if we get a cough or we get a cold now, you automatically panic thinking that it's COVID-19.
Boy, I cough a while ago and I'm telling you I'm ready to go and say, check me, I have COVID. But now, since I did my parathyroid surgery, I have this, and my throat will just start itching so bad, and I was like praying, Lord, don't let it happen and set, but it did. But it normally passes.
So it goes. All right, guys, we're going to take a quick break, and when we come back, we're still in Tobago because today is Tobago Thursdays. When we come back, we're going to dip in some tamarind sauce. What does that even mean? We'll find out when we come back. Stay tuned.